All right, looks like we are live. Folks who are viewing are getting really familiar with this side of my face because I keep looking this way to make sure the stream is going on Hoova. So good, almost afternoon, still technically morning, everyone. Thank you for being here today. Before I get going with this particular session and introduce this session speaker, we've got our typical housekeeping to walk everyone through. This particular session is going to be fully conversational. So there's not a lecture, there's not a big slide deck. With that, though, we want as much engagement as you can muster. So my job as kind of moderator and facilitator here will be keeping an eye on the chat box and the Q&A box. So I'll keep refreshing Hoova. I'll keep an eye on the Zoom chat box. Please ask questions as you have them. I'll do my best to field those. All right, so put a pin in that for a second. As I said with the chat boxes, please use those. You'll find a chat box and Q&A box built into Hoova. And if you're looking at the stream itself, you'll see a little chat box next to show captions on the Zoom side of things. I'll keep an eye on both, so ask questions in both. You can ask questions verbally, but you're all muted, so we won't be able to hear you. A reminder for those who are looking for certificates, we will send a survey at the end of the whole series. So that's after next Tuesday, August 26th. Fill out that survey and we'll get those certificates going for you. A big thank you as well to our partners and sponsors this year. This is the first year we've tried any sort of sponsorship program, so it's always great to see the early folks hopping on that earlier. So big thank you to We Work for Health Washington, the Washington State Department of Health, both their drug user health program and their Teen Health Hub, as well as the Healthcare Authority and Friends for Life campaign. Now, it is my pleasure to introduce our main speaker for this session, Jonny Fernandez-Trujillo, who is a bilingual community health coordinator with Neighborhood House. Now, she's been with Neighborhood House for about a decade now and has over 2 decades of experience with education and outreach. That is just awesome. Jonny, hello. Welcome to the session today.
Thank you so much, everybody. I cannot see who is behind the scene. I just want to say thank you deep from my heart to Washington Poison Center for the opportunity for having me this day. And I also want to take 2 minutes to send my gratitude, my blessings to Miss Phyllis Little, rest in peace, Miss Alia Messiah, who has been my mentor, my supported as well, Vanessa Granberry, Walter McKenzie, and everybody in my past work, where I worked for almost 10 years at Pucan. And I want to thank Neighborhood House for the opportunity for letting me growing in many ways. I've been very grateful to have the pleasure to work with Waria Potan, who was our first director in my program. Kenny McLean, who rests in peace too, and my manager, Mike Graham Square, who I've been learning a lot from skills, responsibilities, knowledge, wisdom, and I want to thank the rest of my team, Ileana Acosta and David Cruz, Melissa, who recently moved to another program, and Abdul Gavini, who is an amazing person, a wonderful care for the community, who represent another coalition who we work partner, like we do a lot of work together. And I want to thank every single person who was representing the Latinx Team Coalition, who has been an amazing learning for me in the last 4 years. And I want to say thank you to Gaine Sanchez, Gaine Ortega, and Irina Ortega. They are a team family. And they are amazing, doing a lot for the prevention, for the youth substance prevention. And I don't have words to say thank you for their partnership, for their willing to support and all the knowledge they have around. Thank you so much. And again, my name is Jonny Fernandez. I'm original from Mexico, Veracruz. I have 2 kids. I know the meaning about being a mother, the challenge to raise a child, and the challenge to be an immigrant, and the challenge to don't be fluent in the language we speak in United States country, that is English. So my first language is Spanish, and I'm doing my best today. Thank you so much.
Well, Johnny, what a wonderful way to start off. Thank you so much for that. Just a quick comment. Part of what I love about this work within public health is it's such a small world. We all interact with each other in so many different ways. And there are a handful of the names you listed of like, oh, I've seen them in a coalition meeting. Oh, I've sat with them in a meeting before. So that's always a pleasure to run into folks we know in these different contexts. Also, you're speaking English wonderfully. So thank you so much for being here, sharing your experiences, sharing your expertise. Um,
Thank you.
I think maybe a good starting point for those who are not familiar with Neighborhood House. Can you tell us a little bit about your organization?
So I had the pleasure to be welcome at Neighborhood House in 2015. And I want to say Neighborhood House is founded since 1906. So we are celebrating our 119 years serving our immigrants and refugee people. I want to share that we are around 35 languages and serving different communities. So the good thing about Neighborhood House is they ensure the people we serve are the language, uh, original language, So that's amazing because this is how I got into Neighborhood House. They were looking at a Spanish person who represent the Latinx community. And I would say Neighborhood House, the main mission is to engage community to ensure we end poverty and to reduce crisis, in our families. So by that, we always are doing fundraisings. We always looking your support. Please, anytime you see Neighborhood House, looking for your dollar, please ensure you donate because Neighborhood House ensure that money goes straight to our family in need. Thank you so much. And I want to say the programs we have. So Neighborhood House is divided in 4 groups. So we have the child development, who serves since pregnancy until 5 years old. We have the community health, who serves mental health services, preventing or doing the service for hepatitis C, HIV, substance use. And we have the employment and housing program. So we always encourage our families, if you have a young adult who don't want to go to school, please, one of the part we do as prevention, so substance prevention, is to ensure our kids continuing education or looking for work. So employment is one of the wonderful programs we have at Neighborhood House, who helps our young immigrants kids to find and to learn the skills, help them with the curriculum, and find the best fit work for them. So please reach to us if you have a young adult who don't want to go to school or cannot make it because money is everything. And also we have the youth and family service. This is the program where I work for. Thank
Wow.
you.
Thank you for going through that. I honestly did not realize Neighborhood House has been around for that long, over 100 years. That's impressive. Wonderful. Thank you for sharing that. So let's talk a little bit about your current role within Neighborhood House as a community health coordinator. Take us through a day in the life of Johnny. What is your role like?
So first, my role is prevention coordinator. I call myself community health worker because this is the title I had before. And I dress that hat very proud, very faithful, like we can make better tomorrow, like today, for a better tomorrow. So that's why I call myself Community Health Worker Prevention Coalition, so coordinator. So my role there is to ensure we engage Latinx families, focus on families who have kids 7 to 17. We can go past to 24. We can go past to 40s if the family are looking at results, but our main focus is to reach families 7 to 17 who they have kids in elementary, middle school, high school, college, and And we want to ensure we engage families, especially who they don't know how to navigate the system, how to reach a resource to ensure family well-being is first thing serving in their family. So we are very, very deep working on mental health. Like anybody who needs resource, we do our best to find resource for them. And our priority is to prevent our kids from substance.
Wonderful, thank you. We didn't plan this question earlier, but it dawns on me if someone's watching this session and they're like, "Oh, I want to get involved. I want to learn more about this program. I'd love to be a participant in this program." How would they start that?
First, they can call us. We are a very small team in our Latinx Dream Coalition. For sure, we will return calls. We will get in contact with that person. We try to do the same day. Sometimes takes more than one day. We want to ensure our families doesn't feel afraid to reach to us. We are so blessed to learn about their needs, about their family first. And we have our Latinx Dream Coalition was planning in 2021 when we were in the middle of COVID, and was funding in 2022. So to plan the Latinx Dream Coalition took lots of support from the community, lots of ideas and meetings, and we were able to finally put together the coalition and name it as a Latinx Dream Coalition. In Spanish, Los Sueños de la Coalición means which are your dreams. So tell us about your dreams, So we are here to support you. Everything ends on having our kids, helping our parents to ensure their kids are having a healthy environment, a healthy development. So we want to ensure our parents are able to talk about their concerns about in case some of their kids already are using substance or smoking. For us, if we see our kids having a cigarette, for us it's like not a good sign. We wish our kids never use nothing. So because we believe the cigarette is the open door for anything else. So or alcohol. So we want to ensure our families are able to reach to us, and we are here.
Perfect, thank you. I just copy and pasted the link to the Latinx Dream Coalition that you had sent me earlier into the chat box, so folks
Thank you.
check that out if you would like. I'm going to do my best to be on top of sharing links as they're pertinent in the conversation, so really keep an eye on that chat box. All right. So I heard you mention, you primarily focus on folks ages 7 to 17, but you could, we can always work with folks who are older. And that, one of your main roles is to really engage with Latinx residents in the area. Now, when you're doing your outreach, whether you're finding folks for the program, whether you're in the program itself, I guess this is kind of a two-part question. First part, is all of your programming available in Spanish and English?
So sometimes our Latinx community, I would say they are second or third generation, and they are not fluent in Spanish. So
Sure.
sometimes we need to have interpreter, like from Spanish to English. Our focus in our coalition, our Latinx coalition, is to serve our King County families who are Spanish speaking and other language. So because sometimes they may be speaking other language like Mexico, Guatemala. We have indigenous communities. They are from our country, but they are not Spanish speaking. They speak other dialects. So we have to ensure we are able to serve them. So anybody who recognizes themselves as a Latino, Latina, please feel free to reach to us.
Perfect. Thank you. And that's such a great reminder, what you just said about like they may be from a given country, but they may not speak Spanish. They may speak another dialect. So then it's on you as the you in neighborhood house to like find the appropriate interpreter, and all of that. Thank you.
Thank you.
Now, kind of a big, broad question. Do you find that you use different or very similar outreach strategies when you're reaching out to folks who predominantly speak Spanish, predominantly speak English, or any other language?
I would say I think unconscious I do different
Mhm.
because you know our culture, our Latino community is very friendly, very open. Sometimes people say to me, "Do you know them?" I said, "No." "Oh, I see you were talking so friendly," and I said, "No, it's just I just met them. It's just because it's natural, you know. We are so open, like for the conversation, and we are so welcome that this is our culture is so natural." And I would say when I'm talking with other communities, I tend to think, do I am disrespectful, you know, because I know sometimes you cannot look to their eyes and you have to talk to them like face down, or I'm not used to hug people, but I know from other cultures they like to hug us. For me, it's okay. And when they come to me, give me a hug. Okay, I give hug to them. But in regards to the conversation, I just ensure I am very respectful and I use the proper words to communicate clear, to don't create a boundary, because I learned from other cultures when I'm talking about or promoting the workshops we do. As an example, guiding good choices is focused on preventing our kids from substance. Yes, so and I show them the flyer, and the topics on the flyer looks perfect. And when I disclose uh, w- what is our main focus, sometimes they said, "Why are you talking to me about substance? My kids never going to use substance. They just walk away from me." Or I can see their face change. I've been learning like I have to be very like careful, or if I feel like I should not say no more than what it is in the flyer, and I ensure to give to them the phone number they please to reach. So if you want to sign up, you want to know more about, please reach to this person who is Abdul Gobini. He speaks 5 languages, and I feel like he's the perfect person to ensure the full outreach is made, you know. So, and yes, the answer is yes, it's different between our Latinx community and other languages.
I really appreciated what you said too about like your own kind of like the way you kind of unconsciously carry yourself when you're speaking in Spanish, for example, versus English. You know, I only speak English, unfortunately, but I notice that I carry myself very differently when I'm in a space like this, when I'm up in front of a group of people, like in person, if I'm at a tabling event. And it adds all these other layers of complexity when you have to remind yourself of these different linguistic cues or cultural cues. So I appreciate you walking through that.
Thank you.
Yeah. So you mentioned the Guiding Good Choices program. Do you mind if we talk about that for a little bit?
Yes, thank you so much. So I would say guiding with choices, it is a base evidence program who, I'm sorry if I forgot the year, since 1986 is a national curriculum training, but was funded in UW, so University of Washington, and now has been split all over. Neighborhood House has, I think, 16 years serving the Guiding Good Choices training, and 8, unfortunately, yes, because the funding now we're getting like we have to reduce the languages. We have to be more focused on which languages has been more like priority, the ones. So I would say first we serve Guiding with Choices a neighborhood house in 8 different languages. One of them is Somali, Amharic, Tigrinya, Vietnamese, Chinese, Oromo, English, Spanish. And the ones we may be ending with the funding we have now will be the top ones is Vietnamese, Oromo, Somali, Spanish, and English. So that would be 5. Yes. So I want to say Guiding with Choices is a program, a curriculum to ensure we have the opportunity to help our parents who have kids. The curriculum says 9 to 14 years, yes. So we have to ensure our parents who have kids those age qualify for our training. And this is to prevent our teens from risk behavior, about to ensure our kids know how to make good choices, healthy choices. And we have 5 different topics. I don't know if you want me to talk about them, or
Yeah, let's
please.
do it. Let's dive into the topics.
Thank you. So before the pandemic, before COVID-19, so we were doing all the workshops in person. We always ensure we have a place. We have a we have 2 rooms, one for the workshop and one for babysitting the kids. Like we offer this in the past, this service. We have dinner because most of our schedule were in the evening, like Monday to like Sundays too. Like, but most of the time, Monday to Friday, 1 day a week. So we were meeting 5 days, 1 day a week. And most of the time, our workshops has been done to now because we do more online. We want to go back in person because it's important to connect with people in person. So going back to before COVID, we were doing in person. And we have different activities with our little ones while we were having another room doing our workshop. So unfortunately, yes, now we have to change. And after COVID, we developed the idea to start doing online. And UW trained us at a 6 sessions. So the curriculum is 5 sessions. So and the first one they add is because they want to ensure parents know how to use the Zoom application, how they can use the tools to respond, to participate, how we can do breakout rooms. So we have a training before to start this new work in the community. So that's why if we do any training online, will be 6 sessions. If we do in person, will be 5 sessions. So the first session, we talk about promoting health and why it's important to practice well-being. The second session is about why it's important to make clear standards in our family. As example is like sometimes we say, I don't want you to come late after school. I just want you to be here at 4, but we never explain why. And that's not a tool, or that's not the way to build trust between our kids and parents. So we learned that when we make clear standards, like if you come after school, is because I'm afraid maybe something happened to you, or because it's time to make chores at home. And so just have the conversation all the time with your kid, why you say no, why you say do this, and not just demanding them. This make our kids to be apart and make them to be close to us. So the third session we have in our workshop is to learn how we can deal with anger. It's too easy, especially I want to use this time to share with the Latino community, the parents. We not only have family here in the United States, we have family in our country. So our culture is like even if you don't live with your parents, you still take care of them. And when I say take care of them, it's financially. And some of our families, they don't come to United States with their kids. They come alone, and they work here, but they have to send money to their kids they left there. And some of the family build a new relationship here, and they have other kids. So that is a stress situation for them in regards financial, because our culture is no matter what, but you have to ensure you provide for your family. And something we learn is we don't have only one work, we have 2 or 3 works. We work from 4 a.m. to 12 or 1 a.m. So sometimes we not even sleep. We go from one work to another one. It's like a marathon life. And this is a stress we don't see, but we put back on our kids. So, and this is the reason the two psychiatrists who made this training, guiding good choices, was built in regards the the concerns the parents were showing. Like, I don't know how to talk to my child. I don't know why they don't share anything with me. I don't. So this is how the curriculum was developed in regards the background information. And this is very, very true. Like, we don't see ourselves how we act when we are stressed, or when we are overwhelmed. And the victims are our own kids. So we have to ensure we learn those skills. Like, if we are angry, how we can separate our feelings from our kids. Like, if I'm angry, recognize what I'm angry, and how can I ensure I don't put this stress or these sadness feelings on my kids, and build a conversation and express to them, I'm so tired, I've been working a lot, or I've been so hungry, I've been not eating the rest of the day. I'm sorry, but you should not do this way. And just have the conversation and explain to them. So this is the third session about guiding good choices, to use angry in a positive way to have the conversation with your child. The fourth session, we invite our kids. So we ask the parents to please bring your kids to the room or to the place we have. Invite them. Parents says, I don't know how we'll make my child to come to the session, because I don't have that relation with them. So it's challenge when it is in person. That's what we recognize. In person is very challenged. Parents show up to the session but doesn't show with their kids. I know they feel embarrassed, they feel upset too, because they see other parents bringing their kids and some they don't. So it's a very difficult situation for them. But we always say, don't worry. If your child don't want to come, please avoid to create a fight. Just have the conversation and explain. If they don't want or they refuse to come, you will build trust, and you will have other opportunities to share with them what you learn in the session. So we always ensure our parents learn that, to don't push your child to learn something, because they will not learn, they will not listen. So this session about where our kids should be there present, it's about how they can learn refusal skills, how they can say no to their best friend when they are inviting them to skip school or to go to the store and just grab a bag of chips and don't pay for, and just those kind of challenge they create to see who can do what, and at the end they ending in trouble. They ending sometimes be called by the police, or when they start using vape. Like in these days, the top concern from our parents is some of our parents report their kids are already using vape, and they didn't have this conversation before. So how they can help their kids to teach them to practice their future skills. When this child says no to their best friends, they will not feel guilty or they will not feel afraid to lose this friend, you know? And so we want to build confidence in our kids to prevent making wrong or negative choices. So the last session we have is how they can bond strength in their families. Why it's important to show love to your child. Like in our culture, we don't. I learned to hug people here. To be honest, I don't remember no one time hugging my parents when I was a child or receive a hug from my parents, and I never remember in my head see other families doing so. I feel the hug part is American culture or has come from other cultures, and everybody here has learned that. I love that because the the psychologist especially says you should hug your child at least 12 times a day, you know. And I always tell the parents, please ensure you hug your child 12 times a day. They said, how you want me to do 12 when I'm not even doing one? So but it's important to learn how we can show love to our kids. And the first step is smiling to your child. Um, breathe, like breathe when you feel like you will be upset. You say, you know, son, give me a hug. I know you didn't mean to do this, and let's talk about, you know. And this is are all the topics we have in our guiding with choices, and there is a lot activities behind, a lot information behind. I just can be here more long, and I don't want to take more time.
No, that was fantastic. I've jotted down a couple more questions that came to me while you were going through that. I'm gonna refresh Hoover again to see if anyone is asking questions here. But a couple themes stood out to me that I'd love to ask you a little more about. This is partially a comment, partially a question, I guess, is I heard you bring up anger a couple times and how this program addresses anger in a few different ways. And my comment, I guess, is just that how like I find that very impressive. I think it can be very easy when we're focusing on like a substance use prevention or harm reduction training or curriculum to focus so much on the this drug does this bad thing to your body, to your brain, and to focus on the I mean, unfortunately, kind of a more outdated approach of just say no, and not digging into more. And I really love that your programming dives into so much around substance use. Um, is there more about this idea of the importance of tending to anger you'd like to speak about?
I would say our culture is very religion. Like
Mhm.
that's the matter, you know. If you are Buddhist or like you practice Buddha or you practice Christian or 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 you practice other religion, like they really they so we I say we really tend to to say this is this is something God will not accept it. And I will say as example using tattoos, you know, or using purse like the model of our kids, or having earrings if you not a girl, you know, and all kind the new the new live in our youth. And our parents will be rejecting their kids, like, why you have those in your face, why you didn't tell me you have this tattoo, and why you dressing pink color? Pink color is for girls, or why you wearing short? Short is for boys, it's not for girls. And so all that kind creates a negative ambient, familiar, and doesn't welcome your child, so your child feels unwelcome in their own family, like so about angry, we have to recognize like I cannot accept this. How can I help myself to have this conversation with my child? Because I almost going to put some hands on him, and no, that's not the way to respond, because your child already has the earring, your child already has a tattoo, and there is nothing to do, only the conversation. And ask, tell me more about what you were thinking when you did that. Tell me, I want to learn because I don't want to judge you. And I see your friend does this. So angry can build a very disconnected relation. And that's the main topic, like if I'm angry and we control ourselves when we are angry, and our kids know that, like, I'm so angry, but I'm controlling myself. I'm using different skills to communicate. Plus, I'm learning to listen my child, and my child is able to share back to me. And it's important after we hear our kids to don't use the information to against them, because believe me, they will not share anything else if you use the information to against them. So it's important to use your angry to build trust. And when we say angry, those skills can be applied anywhere, but we are focused in the relation with your kids, and the relation between your partner. Like if you are angry with your partner, you matter how you control your anger in front of your kids, because your kids will be an adults, and they will just copy what you were doing when they were kids. And it's just a path, so. And I want to go back to the religion, because our kids sometimes they say, I don't want to be no more Christian. I want to be nobody who believes in nothing, because I don't believe in nothing. So parents can be so upset and afraid. And it's just time, it's just time, because our kids has many questions. They want to build their own me. And it's important to let them to think, to help them, to guide them, have the conversation. If they end and to do what they wanted, life says, wisdom says, let them to fall, and they will learn what feels to fall. If you don't let your child to fall, and you always carry your child here on the top, there is a time you will not be there. So what your child is going to do when you are not there anymore? So please, uh, as hard as a parent, I learned that. And when I'm saying this, I learned that this is my story. Thank you.
Thank you. Well, and it's just I keep nodding along because I'm just processing, like, using anger as an example. This programming is about so much more than substance use prevention. It's from what I'm hearing, it sounds like it's largely about like healthy conflict, how to have healthy conflict, and how to balance guiding children while respecting their own decision making.
Yes.
Whether that's with like I said, beyond substances of gender expression and like body autonomy and religious choice, and there's so much in what you just said that I'm getting goosebumps just kind of
Thank you.
mulling it all over.
Beautiful.
I something I'm kind of processing too as you're going through this. You mentioned hugs as an example, and like physical showing physical affection, and whether it's hugs or physical affection or really any other thing, it just strikes me that it must be such a challenge to provide these suggestions in ways that still like honors tradition and like traditional culture. Is there anything you'd like to say on that?
Yes, I would say it's hard when there is resentment between your child, or your child has resentment towards to you. Like you want to hug your child so bad, but your child is refusing to do. And we learned that it's important to create that space, like just show your child you want to hug them, and there is a time they will come and hug you, and you will feel so much grateful, and you will see that the many tries you did meaning a lot for your child, make your child to think. And if you want to hug and they don't want it, please don't be upset. Respect their boundaries, because they are creating boundaries, and those boundaries should be applied anywhere. Like, you should, it's important to tell your child, good job, son, I like that, because I don't want nobody to hug you if you don't want it. I don't want nobody to touch you if you don't want it. So use that like rejection to use for, because it's a good thing. When your child says, I don't want it to do, and I'm not going to do, okay, don't do it. But there is a time you have to do. Oh yes, when, I don't know, I'm letting you to choose. I don't want to waste time discussing because I have my own things to do. So, and the child says, I better do right now. And then you see your child doing, because you didn't make a conflict, you let your child to think. So this is like, our brain works like that. When you push somebody to do something, immediately they will say no. But when you let them to choose if they wanted to do or not, they say, I think I wanted to do. I think it's better to avoid problems. Later, my mom will not allow me to play games. So they are thinking. But if you force your child with a weapon, pulling their hair and doing the wrong way, it's not going to change. He will tell you many times no. So, and I'm sorry if I went out from the angry, but that's angry for me.
No need to apologize at all. This is all, as I see it, very connected. And I chuckled partway through that too, because I grew up, I mean, I still play a lot of video games, but definitely grew up playing video games, and my parents would use that as a like, all right, dude, you went too far, no more games for a while. It's like, yeah, just effective strategy, at least for me.
Yes,
Um,
it is. Thank you.
so I have kind of a logistic question around the in-person versus virtual sessions or online sessions. And I caught you said that, one difference is that for the virtual sessions, you have an additional session that's all about training, how to use this virtual platform. Um, and that it can be more of a challenge getting the kids involved in the in-person sessions versus the remote sessions or the online sessions. Does anything else, having done both, does anything else feel different to you about those in-person sessions versus remote sessions?
Thank you for asking that. So, yes, it is a big difference. We learn, because when it is in person, the I would say the little ones always, doesn't matter online or in person, they always put their hand up, they always want to participate, they're ready to answer, the little ones, because what? Because they don't have already that feeling about people are judging me. When you are starting to be a teenager or a young person, you are starting having that conflict, like everybody's looking at me, everybody's judging me. So, and that refrains them to participate, the old ones. So the difference is, so that's the little ones, yes, like I would say 7, 9, 10, they always want to participate, and they are amazing responding the questions, and they are so good, like the step by step about the refusal skills. um the teens or the youth, they they want they want to say something, but they are afraid to put their hands up. They will participate if you call their names, or if you have prizes up front, like, okay guys, wherever who participate the most, we will recognize them by claps, and there is here 3 prizes. You will be able to come, and choose wherever you want the table. So that's a motivation to them. So they already forget about people are judging me. I may say the wrong answer. No, they just focus to the price in the table. So this is instance has been working for in-person workshops for the old ones. When it's online, there is no prices. There is no prices, but we have a game. Was built from so I don't know from who was built, but we implemented under the Sanchez Guiding Education Program, who I mentioned before. They are one of our facilitators in Spanish for guiding good choices. So they implement this game about what you prefer, to be a train to transport people or to be an airplane, and why? Oh, airplane because I will go more fast to wherever I go. No, train because I can see the nature. So it's like a game, but you are building, like you are open, helping them to communicate and to participate. So, but what happened when they are behind the scene, and even with this game, they don't want to participate. So what we say to our parents is like, please just sit next to your child. Not even tell them you doing this because you want them to hear. But when they start listening the conversation and the topic, is when they're going to be like whispering in your ear and says, "No, mom, it's this." So you say, "Okay, type in chat for me." So and you will see you saying something, but it's your child saying, or just tell your child, just tell them to don't open the microphone. Whatever they want to say, to please tell you, and you will type for them. So we always use like different tools, skills, but at the end, we want to ensure anybody at home are participating behind the scene. And I I feel like it's been working because our parents says, "Wow, thank you, that really worked." I didn't push my son, but he was whispering in my ear. And it's very grateful to hear those comments from the parents.
That's great. Yeah, that's got to be very rewarding to hear those little moments when you're like, "Aha, it worked."
Yes.
That's great. I'm seeing a couple comments in the chat box, so I'll just read this one aloud. I agree, it's about modeling and letting them find identity, and also sharing and learning and showing love and good communication. The fall part you mentioned is very important because, as we know, that is where they find the things they don't want in life. Gracias, Johnny. Positive reinforcement rather than negative. Sounds like a great workshop. Another person just saying thank you, that they're learning quite a bit. Now there is a question. Yay, folks! Thanks for asking questions. In the Q&A box here, how does your organization support families who have limited literacy and comprehension? And are there any cultural considerations there?
Thank you. So I feel like the curriculum has been modified in the time I've been working for Neighbor House, and and delivering this workshop to the parents. I think has been around 3 times we having meetings with UDAP to change a little bit the vocabulary we use in the platforms, because good example is like they said, let's talk about risk factors, or let's talk about the protector factors. And we use factors, people says, I feel like I'm talking about like building a business, or I don't relate that to my family. Can you give me more details? So this keep going with the families. We know when we have those activities where families share in the chat or open the microphone, or when we are doing in person, and we say, what are the risk factors in your community? So doesn't work. So we have to use a very common, simple vocabulary for our families to understand the curriculum, So the question is, what do you think will make your child to start using substance? What can you do to prevent your child to start using substance? So it's so different than, what do you think are the risk factors kids use substance? What do you think are the protector factors? Doesn't work. So and it is in every single level. You know, if you go to the doctor and your doctor says you should do, or you should change your well-being, and they say, what is that? You know, it's not, doesn't work. It's very important for the professionals to always think, sometimes our, like, because we don't have experience in those topics, we never hear about them. We cannot start in the level 7 when you have to low down and go level 1, you know, like go to the level 1. If you see they are able to respond, go to the level 2. So, and this is how we learn each other and creates equity communication. And we want to ensure all the time our communication is equal and realize culture with our families. You know, if there is a family who doesn't believe on religion, we will try to don't communicate with this family as in the way we tend to do. Or if this family says, I don't think using substance will affect my child, and I don't know, I don't think so, because I've been drinking my whole life, and I have an engineer and he doesn't drink at all. I don't know how you apply that data in my family. So when you hear that, you say, wow, that's a good point, you know. And we have to validate everybody's beliefs, because it's important to create this equity environment.
Thank you. You know, I'm, I find myself thinking about the example you gave of like, what are the risk or protective factors for substance use versus what do you think led your child to use substances? And even understanding the question, like, what are the risk and protective factors for substance use? I think about, like, if you were to ask me that, Alex, what are the risk and protective factors for substance use? I immediately think about like the public. I think about those who are not me. But if you ask me, Alex, what do you think led your child to substance use? Then I tie it to myself. And so like there's so many layers there, even if all the vocabulary and the language is understood, how you phrase a question can so easily get someone thinking about themselves or everyone else. And yeah, that's really powerful.
Thank you.
All right, I'm going to do another refresher here. We are actually getting close to time. I'm looking at the clock now. We have about
Oh
7 minutes left
God.
in this session. Johnny, I feel like I could talk with you for 3 hours easily. Like this is wonderful.
Thank you.
Um, Now, while folks are thinking of additional questions to ask, Johnny, I'm gonna share the links to those videos that you shared with me on refusal skills. Because we're low on time, I don't think we should show the videos now, but I'll at least share the links so
Yes,
they're
please.
there.
Yes.
And then, folks, what I think we can do is in the community board, that area of Hoover, I think we can do a post that's dedicated to all of the resources we have here. I know I've shared a few in the chat box. Johnny sent me many, many more as well. So I want to make sure everyone has access to those, whether today or if they revisit this on a future day. Now, Johnny, with like 6 minutes to go, I'll keep an eye out for any additional questions, but I want to ask you if attendees, folks who are watching this right now or watching the recording, take away one thing, whether that's an action item, a point of knowledge, or an attitude shift, anything, what would you like that to be?
I want to say thank you for being able to share, to, learn, to, 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 to to be aware about what's going on next next door to your neighbor, but especially to yourself, because it's important to continue putting water in this beautiful flower you are, because it's the only way you can save many lives. If you die, your wisdom, your knowledge, and all the good things you want to do in life is just like gone, and we want to ensure whatever you believe, please continue fighting for that, because it's the only um, legacy you will leave in your kids and your family, the people who believes on you. So fight for your beliefs. It's the only thing we can do. Like, love yourself, believe in yourself, and you will change the world. Thank you so much.
Well, what an inspirational note to wrap up. I'm going to do a final little refresher here. Oh, I'm just seeing some thank yous and accolades in the chat box. No additional questions though. But folks, as we wrap this up, keep in mind, this can be the beginning of a dialogue. It doesn't need to be the end of a dialogue. So whether that's posting a forum in the community board here, whether that's emailing, contacting Jonny, contacting Neighborhood House, getting enrolled in these programs, contacting us, please keep these conversations going. Jonny, this has been an absolute pleasure to have this conversation with you. These are some of my favorite kinds of sessions because it feels so much more, what's the word? Engaging, connecting. I can connect with you as an individual more. And I just really appreciate that. So thank you for taking time out of your day, for preparing this with me, and for sharing a lot of your insight and your experience.
Thank you so much. And I just pray everything is going well for you all, for the people who were here, the ones who will be continuing coming, the next sessions, the whole team for Washington Poison Center. You're doing an amazing work. Oh my God, thank you so much for this wonderful opportunity of learning from everybody, every corner. Thank you so much.
Wonderful. Thank you so much, Jonny.
Thank you.
Now, folks, last thing I'll say before I go ahead and end this particular session, reminder, we're heading toward a short lunch break. We will reconvene at 1:15 p.m. for novel approaches to opioid overdose at the library. We'll have some speakers from the Seattle Public Library share some of their experiences. Wonderful. I'm going to do one final refresher. I'm not seeing anything new other than a bunch of thank yous. So Jonny, all the best. Thank you for joining. And folks, I hope to see you all at 1:15. Thanks, everybody.
Thank you.